case you didn't know, May is International Doula Month, and this year marks the 30th anniversary of Lexington Medical Center's nationally recognized doula program. And joining us this morning to talk about this incredible program is Diane Pound, a Lexington Medical Center doula with over 2 decades of experience. Good morning, Miss Diane.
Good morning.
All right, so first things first, for folks who may not be familiar, can you tell us what a doula is? What do they do?
Okay. A doula is a helper. We assist ladies during labor and delivery. We offer comfort measures. We help them to move, change positions during labor. We encourage them to breathe, we offer massages. We do different things just for comfort, encouragement. We're not medical, so we're there just for the extra.
I feel like y'all are a support team, like a cheerleading team that's right with them.
Definitely.
Oh, I love that. And so my question is, what is the value of having a doula there? Because, y'all, I've already decided I want to have a doula during I'm not pregnant, okay? But when I do have children, I decide I want to have a doula. Can you speak about why it's so valuable to have a doula present at a birth?
Well, we are there with one patient at a time, and we're there throughout their labor and delivery. They certainly will have a wonderful medical team taking care of them, a doctor and a nurse. However, the doulas are there just for that emotional and physical support, for comfort, encouragement, whatever we can do to help their labor to progress, to help them to stay calm, to help them to be proud of what they're doing.
Yes, absolutely. Now, we've got to talk about Lexington Medical Center's doula program. I mean, it's incredible. The first of its kind in the Southeast, this year celebrating its 30th anniversary. Also, I really want to note that it's the only hospital in the Midlands that offers doulas to patients for free. So can you talk more about the program?
Yes, we do have doulas on staff. We have 20 doulas. And when a lady is admitted to the hospital, she can request a doula. We have to say to everyone, first come, first serve. There are some days that the doulas are already with other patients, but we do our best to meet the needs. There is no charge for her to have a doula with her during labor and delivery.
That's absolutely incredible. And we actually have that number on our screen right there if you'd like to request a doula, 803-791-2631. Now, I'm going to brag on you. You are a staple in this program. It's been around for 30 years. You've been a doula there for 26. Can you just tell me, how has this experience been for you to be a doula?
Well, birth obviously is a life-changing event. It's something that a woman remembers all of her life, and to be a part of someone's birth memory is amazing. It really is. We meet some wonderful families. We celebrate with them. We cry with them. We're again there for their comfort, encouragement. So again, it's a life-changing event, and to be a part of that is amazing.
Also, Miss Diane, you just have this calming presence. I know that you are really such a comfort for all of the moms and families there, and thank you so much for what you're doing for all of the families in the Midlands.
Thank you.
All right, my friends, so we're going to put this interview on our website, WLTX.com, so you can reflect back on it or reference it back if you have any questions about having a doula through the Lexington Medical Center's doula program.